Hello, I am Dr. Vivek Jawali. I am the Chief Heart Surgeon for the Fortis Hospitals in Bangalore. Do Indians suffer more with heart attacks? Do we Indians get more heart attacks than the other people in the world? The answer is yes, and emphatic capital letter yes. Why is it so? First, is it true? Yes, it is true. Who says so? There have been a lot of studies in India and world across. In India, especially from ICMR, Indian Council of Medical Research, the AIMS faculty, especially in current scenario, Dr. Srinath Reddy, in the past, people like Padmavati, these people have done a lot of studies and shown that incidence is high, the urban and rural gap is closing. It is wrong to say that it is a disease of the rich and not the poor. The poor and the middle class seems to be suffering more. There was a gap between men and women. That gap is closing. More women are suffering with heart attacks. The gap between young and old, it was a problem of old people, no more so. There are, on average, if you see the major studies, the average age in Caucasians and average age in Indians when they suffer first heart attack, 52 here and almost 70 there. So if you look at this slide that I show you, the Indian map, see the incidence in our country. Look at the southern states of Karnataka, Tamil Nadu and Andhra Pradesh. We have a very high incidence. If you compare to the northeast of India, we are really very disadvantaged. And also, there are some studies. For example, there is a study called InterHeart. InterHeart is a study with huge number of samples, and it is led by a guy in UCLA, University of California, Los Angeles, by a guy called Salim Yusuf, who is a very renowned cardiac epidemiologist. He is originally from Bangalore, an alumni of St. John's, but he is very respected in the world. InterHeart study showed that if you look at the ethnic cauldron of United States, the Indians, the Caucasians, the blacks, the Arabs, the Oriental Chinese, we are the worst sufferers. And if you look at the socio-economic strata, we are high on the socio-economic strata. We eat well, we have healthy habits, we exercise, we eat right, we do everything right, and many of us there are doctors, but still the incidence of heart attack among us in US is very high. So Indian migrants there. Now if you look at Indian rural migrants in the cities, it's the same story. They start getting more incidence of heart attacks. Now why is it so? You get heart attacks because of a disease called coronary atherosclerosis. Coronary arteries that supply blood to the heart muscles. Through the blood, we get the oxygen that we breathe. Through the blood, the muscle cells get the food that we eat, and on that, the muscles function and the life goes. Now, these vessels develop blockages due to plaques, deposition of cells and fibrin material, etc., and the blood supply is not good, and they will get a heart attack. Now, this is happening because of certain traditional risk factors all over the world, whether it is wrong eating, lack of exercise, diabetes, blood pressure, cholesterol changes, etc. But in Indians, if you see, on top of these traditional risk factors, which are very important for the migrants, but there are a lot of non-traditional, very local Indian factors. And these factors are not very clear, but we can diagnose if these things are happening very early. In these unusual risk factors, the responsible factors are heavy urbanization, increased stress at large, air pollution. If you see the PM 2.4 particles in the air, and if you look at the Indian map, you will see that north has got a very bad pollution, but it's not that it is less anywhere. By WHO standards, we should be breathing in the air less than 10 microns of these particles. You can say micrograms. But if you look at Karnataka, if you look at all other southern states, it's far high. But if you look at the northern state, look at the map, it's very high. So there are many risk factors which are very local. There is something also called as the fetal hypothesis. What is this fetal hypothesis? If a mother during her pregnancy the baby is in her womb and the baby suffers stress, whether the stress is psychological from the mother, whether the stress is of some disease in the mother, whether the stress is of malnutrition, hunger, or any kind of stress, then this baby will suffer. And this baby will develop this fetal syndrome, which later on can be expressed in the adult age with heart attacks, strokes. So this fetal hypothesis also, there is one more very interesting factor that came up in sub-Saharan African countries where there was too much of starvation. These babies which are in the womb, they develop something called as starvation genes. And when the baby grows out of the mother, it's able to withstand starvation quite a bit, unlike any other babies elsewhere in the world. When they grow and when they migrate to urban areas of Africa, or they go to US, or they go to the Western countries, suddenly their food pattern is changed. Suddenly they are among plenty, but most of them still are poor there, and they may be eating very unhealthy food, unhealthy oil, and all this will completely ransack their metabolism, and they fall easy prey to develop heart attacks and strokes. So these fetal theories. So there are a lot of these peculiar problems, peculiar to us because of, and also there are certain fat substances, cholesterol. The good cholesterol is less, high cholesterol is high, the bad cholesterol is high. There are certain proteins called lipoprotein A, which are carriers of all these plaque makers. They are higher in this population. These are all local factors. All this can be diagnosed. So if they are undergoing medical checks, especially there are people who are not high risk, there are people who are at high risk. Those who are at high risk have to be very vigilant, and they have to go on checking themselves annually. Those who are not at high risk, at least at the age of 40, they should wake up, because they are Indians and they must at least 3 years once, 2 years once get checked. So 3 bottom lines. A, we are highly prone to develop heart attacks. It is probably in our environment and in our genes. What about the genes? There are almost 880 loci found in the gene scripting where there may be bad genes. But there is one gene that is being zoomed down upon, that may be the faulty gene. If that is truly discovered well, today we are in a wilderness, but if it is discovered well, then some smart people among you will come up with some technique of gene manipulation, and suddenly the treatment may become very simple. But we are sitting duck for this. And the good news is that this is highly preventable, it is highly diagnosable at the earliest stage, and it is treatable. So thank you very much for your patient listening.